Yes, I am a clinical mental health counselor, and the CFLE is a certified family life educator. So, of course, that doesn't, just in general, that was my undergrad certification, and that led me to clinical therapy, pretty much. So, yeah, parenting. So we started before COVID in January with this lineup of parenting classes, workshops once a month. And this was one of the original kind of lineup. So I did the emotional coaching, and we've done parenting with boundaries. We've done okay is the magical word, how to follow instructions. There's so many just basic ones that I've done. And this happened to be already scheduled for May. So I don't know how perfect this will be for you, but it's perfect for me. It's perfect to learn more, because every time I do, I make a new PowerPoint for these and research, and then there's new findings with what's going on now. There's new symptoms, there's new anxieties. And so 101 is my favorite, I'm writing a book that has a 101 title in it. And it's just my favorite because 101 means it's just basic. So it's educational. This is a 101. This is just your basic, that it took me a while to get through, in college, those 101s. But so it's just know right now your anxious brain say, oh, it's not 101. It's not college algebra. It's not math. It's not, English, but it's just anxiety. So we call anxiety a lot of things. So we're going to talk about that. First, here's the benefit. We kind of put this on our first slide of just knowing and what your benefit offers you. There's a little list. We have a crisis line 24/7. You can call the main number during, you can talk to a crisis worker, you can talk to a therapist, or if it's after hours, there's always someone to talk to. And I've put those other numbers, crisis numbers and uni numbers, and in other PowerPoints, but this one's just, it's just anxiety. It's so just know that we are here to help you in lots of different ways. And also, as you have learned, if you've taken these in the past, right now, and who knows but the benefit of these free webinars are for everyone and anyone. So you do not have to be a part of a company to have these. So you can go ahead and forward these videos to anybody you think, your cousin, your aunt, your partner, your spouse, like have them watch it later too. And anyone can sign up for these. Like tomorrow is going to be a financial one that is just going to be phenomenal. So we have financial benefits, but like it just goes through just all this financial great information, how to stay on budget, lots of good ideas. So you just sign up and you can just put your company in, and it doesn't matter. You can just put Blomquist in there, but so anyone can sign up for these. If you have questions about that, we can ask Heather about that. So first of all, we have to talk about, no, I just changed my, the unknowns and the unseens. If you know what this means, that we have currently a lot of unknowns and unseens. So 2 months ago, we had a lot more unknowns and unseens, and now we're just confused about the unknowns and unseens, if you know what I mean. So a pandemic is unknown, unseen, a virus, the earthquake, all those things that cause us acute stress. So this is just education on this. So here's a traumatic event. Acute stress, it's a short term. We have a stressor. It's a 1 month thing. We don't have symptoms much after that. Then we go into an adjustment. An adjustment is 6 months-ish. It's just, we have these symptoms and stress, and because of the traumatic event, we go into 6 months. We're on 3 months, right? We're almost on going on 3 months. So we are in the middle of an adjustment. It is not very fun for kiddos, I am telling you. And if they're having a great time, with not going to school and having soccer canceled, camps canceled, activities canceled. I mean, I could go on the list and list and list of all the things that we're grieving. That's going to be a very long adjustment. It's going to be through the whole summer, for example, right? So now we will be in 6 months. So what happens is, if we still have symptoms from that loss and grief and we haven't emotionally dealt with it, per se, then we go into post-traumatic. And if we don't treat it in those 6 months and kind of calm the nervous system down about these stressors, we go into post-traumatic, and that can be long-term. And those things can come up. Now, it doesn't mean long-term that you're going to have symptoms. It just means that it's going to be trapped in the brain sometimes, and that's a whole other class. But this is just the basic. So we have a trauma of emotional loss, grief, and trauma, and powerless. That's where we get into trouble, is the powerless word that I've always used with my emotional charts. So powerless is where we have trouble. So how to combat that is to take back the power. So how do we do that? Lots of different ways of coping, and how we've done some of these seminars, webinars, like, emotional coaching and good activities and creativity and all those things of like how to combat loss and grief. So it's serious. Here's the acute, and then this little picture, it's kind of like, here's this stress, and then the chronic is definitely, so it goes along with that same lineup, is here's the acute, here's the adjustment stress, and then here's the chronic stress. So this is the biggest PowerPoint section that is so important, that I educate people on all the time. The difference between worry and anxiety, and what anxiety is. We love to just, no judgment, we call out a lot of things anxiety, right? We call this anxiety, we're having this anxiety, this gives me anxious feelings, this is anxiety, that's anxiety. So the thing is that's okay. We call, my child's having anxiety. Well, are they? Are they? So this is where we've got to know what anxiety is first and what it isn't. So then we can properly get treated, properly find the right medication if needed, proper coping skills, and then what's severe and what's not, and what's normal and what's not. So number one, worry. Worry is normal. It's mild. It's temporary. It's verbal. It's your mind and thought. It's in your mind. Okay, it's just in your mind. It's thoughts, and it's inside there. You usually can have a given situation, and then you have a given solution. A lot of kids, and as parents and us, we can have a worry, and we can have a stressor that goes into a situation and then a solution. Okay, and it's controllable because we can do that self-talk. I mean, that's what this whole side, on this side of this worry, if you can see my screen, for those that you can't, or that you're on your phone, just know that you're going to get this PowerPoint and this video, so you can go over the PowerPoint. You'll just get this PowerPoint by itself, and all the references, by the way. So if you can't see my screen, you might be lost, and I try to remember that if you can't see my screen. But here's the verbal, and here's the thoughts, and here's the solution, and it's controllable. And it's like, okay, oh wait, I have power over this, and I can do self-talk because I'm still in my frontal lobes. I am not in fight, flight, or freeze in the back of the brain yet. So I can control this. I have a solution, and kids can come up with that. And when they're doing that, that's really good problem solving, and you have to help teach that. You have to help coach that all the time. I have to help coach that all the time. Like, oh gosh, like, how do I deal with this issue when I get irritable at the store, or this or that, or this, and all these weird things that are going on right now. So here's the other side to the anxiety. So there's severe emotional distress and pain. So emotional pain, emotional distress. It lingers. It's in your body. It's physical, okay? You also have mental imagery of, like, future things happening. You don't know how to solve problems. You don't have problem solving skills because you've lost that self-talk that's up here. You can't control it. It's blocking your progress. It's perfectionism. It's personal functioning impaired. So it's clearly daily you have impairment. And ruminating. So ruminating is where we replay it and 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 replay it. And it goes over and over and over again. And that's that, repetitive, severe emotional distress that goes, and it lingers and it goes over and over and over again. Or you ruminate about that mental imagery over and over and over again. Okay. Now we're going to go into specifics of all of these, of anxiety disorders and what that looks like and what category. So anxiety is worry. That's it. It's worry. But anxiety is worry. This is what's normal with worry, and this is what's not with worry. So worry is different than compulsively acting on the behavior. So. Okay, so these are the basic disorders. And now I'm going to call it disorders. I usually call traits or something. This is not to diagnose anyone or your kid or me or you or anyone else. This is just education. You need a professional. I am a clinical therapist. We are the most trained in DSM diagnosing. So we're clinical. We are closest next to a psychiatrist, but we don't prescribe. So we have lots and lots of extra training in that. And so the thing is teachers don't have training in that. I'm sorry. MDs don't have training like as much. So you have to understand what you're going towards if you are going to a doctor for a diagnosis or to a psychiatrist for a diagnosis and medication, or just treatment to a therapist, so we can say, okay, this is really what's going on. I don't diagnose. We don't diagnose. I don't need to. But we look at the symptoms of what's going on so you can get the proper treatment. And solution focused therapy is what we do in that treatment. But if we don't know what's going on, so I always go over these 4 when someone says, my child has anxiety. I have anxiety. Well, guess what? Everybody does, because your adrenal glands are sending cortisol to your brain to tell you to have anxiety. So if it's worry, and we worry, and that's normal, that keeps us alive. But here's the severe chronic worry. That's this top one of generalized anxiety disorder, is chronic state. It's a chronic state. It's a chronic burnout. And that's the 4th level of burnout. It's chronic. It's severe worry and tension. Okay. So that has to impair your life. So panic disorder, totally different. People are like, I'm having an anxiety attack. Oh wait, I'm having a panic attack. So what's the difference? Anxiety is severe worry that sends you into compulsive to worry about the worry. So you worry about the worry, okay? Panic disorder is worrying about panicking about panic. So you're worrying about panicking again because you've had a full-blown panic. Panic attack or panic disorder is only if you do not have an activator or a trigger. I like activator better, but most people understand trigger. So you have to have an active worry that you're worrying about to have anxiety and to have an anxiety attack. But panic is your physiological body that peaks within minutes, and you don't have a trigger, you don't have an activator. So that's when in the middle of the night, when you're sitting and having dinner, you're sitting in a movie, and you all of a sudden just within minutes have panic come over your body. That's panic, true panic, and it's repetitive. So you've had them before, your brain stores that, and then you panic about having a panic. So this is the example. Your brain does not know the difference if you are having an anxiety attack or an asthma attack. Because guess what? it can be the exact same symptoms, the exact same thing in the brain that tells you to stop breathing. So, or a panic. If you're just outside playing and you're having a great time and a kid's outside on the playground just swinging, and all of a sudden they have a severe repetitive panic that they've had before. Now, if they've had anxiety or panic before related to asthma. So say they have asthma, and they've had an asthma attack before. Well, guess what? Your brain says you're having an asthma attack, and you'll just have an asthma attack. Well, guess what? It wasn't an asthma attack. It was a panic attack, because your brain says stop breathing. Oh my gosh, because it's just telling you to do the same thing as an anxiety attack. So sometimes our brain just doesn't know the difference, and so there's no activator. But you're afraid of having a panic attack or an asthma attack, so your brain reacts. And that's without an activator. There's nothing that happens. You didn't run, you didn't see something scary, you weren't in an elevator, you weren't doing something scary in front of the classroom. So there's an activator. That's anxiety. If you have chronic, then that's severe worry. That's the disorder. Okay. So agoraphobia, my favorite to explain to people. This is seriously my favorite, because we have to understand the difference. So agoraphobia is the fear of being trapped. So we avoid places and situations that might cause us panic. So because you feel helpless and embarrassed. So that's power. So when we have our power ripped from us, we go into agoraphobia a lot. So trapped. If you don't have power over certain situations and feeling trapped. So this one is like, oh wait, my kid has social anxiety, or we call it, separation anxiety. And there's both those are separated in the DSM. They are, but it doesn't matter. I don't talk about them much, because these are the basic that they all fall under this. So social anxiety, is it not being trapped? Is it not feeling like you're trapped? If you're in a social situation, or you don't want to go up and talk to someone that causes you severe physiological body, that's an activator. So that's not panic, that's anxiety that sends us into feeling trapped. So it's like, or a presentation in front of a class, or I describe it as you are going down the hall, as adults, or kids, but you're going down the hall with a coworker, and you just happen to be going down the same hall because you've been just, you're going to the bathroom or something, and you're like, oh, I don't want to talk to this person. I don't really like this person. I don't want to confront this person. Oh my gosh, I'm going down the hall and we're going to pass each other like this. That's being trapped. That's the fear of being trapped. So next time you just make sure you make sure that they're at their desk when you leave and go. Seriously, you avoid them, right? Because you just don't want to face them. And so you'll learn real fast to avoid that person, so you don't feel trapped with that person. Is that social anxiety? Absolutely not. It's just, I don't like feeling trapped, and I want to take power over that. But if it's an impairment where you can't go to work and you don't go to work, then we've got an agoraphobia disorder, right? And then social phobias, it's a fear of the exposure to the specific object, or the plane, the elevator, but that's also feeling trapped. So, so like snakes, I always use snakes. It's like, how do we face snakes? Exposure therapy, it's like, oh, so I want to learn how to fly without having severe agoraphobia. And so you do some exposure therapy around that specific object or situation, and you actually face it. You actually pretend you're flying. You pretend there's a snake in the room. You pretend whatever that child or an adult is scared of, and that's called exposure therapy, and that works. Okay, so write down your questions on a piece of paper, or chat them right now to Heather if you have questions about these, or you can always email me, and mine's just Carol@blomquestel.com, and I should probably put that on the first. I'll put that on the first slide from here on out, but it's with a Y, CAYL. And you can always email and say, okay, what about this? Does this qualify for that? And I'm not diagnosing. It's not about that. So it's just about knowledge, so we can like kind of pinpoint what's going on. And then if it turns into a full-blown diagnosis, a disorder, then that needs treatment, and that needs consistent treatment. So these are the additional worries. So this can be the other part of the worries. So of course, in OCD, we worry. We have intrusive thoughts that carry out to a behavior, like I said. So if we have thoughts, so we worry, and we worry about the worry, and then that's okay, we worry about the worry, but we don't act on the worry, okay? OCD goes into, I worry, and I have so many intrusive thoughts. So until I go and do that behavior, like washing your hands or locking the door, or, you know, getting that homework done and staying up every single night till it's perfectionism. And I worry. So I have to compulse on that, and I have to get that done until it's done, and then I can stop worrying about it. But until that's done, I don't. And that's for more than an hour a day. So if it's impairing you for an hour or two a day, we've got a problem. So PTSD disorder may develop after experiencing or witnessing to a traumatic event. We most of us, we've heard of all of those things. We have a misunderstanding about PTSD, you know, of course, but I think we're getting better at that. We have lots of research on that. PTSD is an activator. It does have an activator. So it's like the panic, but it's a physiological response system. Also, it's in the body. Okay. Dissociative is part of this. It's involving problems with memory, identity, and emotion, perception, and a behavior of sense of self. So that's, of course, you're going to worry, right? So we have a identity issue and a sense of self, and that's a deep one. The dissociation, and then you're worry. Of course, there's worry in that. And major depressive disorder, just all your depressive orders, of course, are a lot of worry, because those are very connected to anxiety, your mood or loss of interest and activities, and you worry about stuff and then you shut down. But that one's more of just a shutdown. You're not having physiological symptoms inside your body of high blood pressure, high heart rate, crying, shaking, you know, sweating, you know, like the panic and the anxieties. So ADHD we have to add that in there, because ADHD is very, very compulsive worry. It can go into that, impulsive in activities, in worry, in self-depleting thoughts, but it has to be in all environments. So those are just a little bit of additional things that we worry in these traits and disorders. So a little bit on the vagus nerve. This is just a little bit of what, because this to me is very scientific. I am very scientific in the brain. So and the body. So this is very, very connected to the body. And I always go into the body responses, because our thought comes first, then our emotion, then our behavior. So right before the thought and the emotion that you've seen me do in other workshops is your self-talk and your physiological body response. So you have a thought comes in, do something, say something, you're worrying about something, then you have a feeling, but in between there is your physiological body response, and it keeps us alive. But what's happened is we've gone into chronic burnout, physiological burnout, and we shut down, and then we can't get to the feeling, and then we can't get to a better behavior. So it's all connected. This is just a little bit about the vagus nerve. I'm sure you've heard of it. It sends us in, and it prepares us for the fight, flight, or freeze. Your fight, flight, or freeze is your response brain. It keeps us alive. Like I said, it does as well. But when I'm teaching this for behavior and like relationship stuff, it we can't stay in fight, flight, or freeze. We can't stay in fight with relationships, because then we'll just be very, fight mode all the time. The danger is overwhelming, that there's no escape. If that's happening, then we feel trapped. The third circuit of the vagal operation engineers a shutdown. Okay, so we feel trapped, we're going to shut down. So if your kids get to that trap feeling and they have no idea what's trapping them and what's blocking them, it's because their vagus nerve has shut down, and they like go into a numb state. Their social contact becomes intrusive. It's like it's out of focus, and it's like we wonder why they can't make decisions or focus, is because we're sitting in the midbrain. We're sitting in fight, flight, or freeze. And also, there's a whole other part of, you can also look this up, but just look up the adrenal gland. The adrenal gland can be burned out for adults, for you guys. And I'm going to do one of those in a couple months. I think one of the subjects is, are we burned out as parents? I think by the time we get to the end of summer, we might be, chronically burned out, because a lot of parents are like, I know, it's like, what, we've already had summer. Are you freaking kidding me that we're going to go through, now we're having summer again? Like, wait, our kids are going to be home for 6 months without doing anything, not dropping them off, not having sleepovers with grandma and grandpa. I think we're going to go nuts. So we're going to have to be really aware of all this. The body response the body responses are not voluntarily happening. It is an automatic response. It's not voluntary. We don't want to be sending cortisol to our body from our adrenal glands all the time. We don't want to be in our fight or flight or freeze, where we just freeze and numb out. This is not voluntary. So we're going to get to how to get out of this, but it's not, we're not aware of the activators. Okay. So a lot of parents come in, or kids are like, I don't know why I'm doing this. I don't know what's happening. I don't know why she's throwing a fit. I don't know why we're, being irritable, and the activator is like, I want to know what the activator is so I can fix it. We don't know. There is some things we can pinpoint of what's going on, but really, do we know what the activator is? This is what I do. I get a Sharpie, a marker, and I say, fill up the walls. My office that I had to recreate here after, we said everybody's home. So fill up the walls. There's 4 walls in this room. Fill up the walls with all of the triggers that we have that would maybe possibly send us into a fight, flight, or freeze activation. There's just lots of things. So that's my point, is like, there's just lots of things, and it doesn't matter. Does it really matter? It doesn't, because it's all just, if a child have a phobia about dogs, because every time a dog barks, it freaks them out because they've been bit. Okay, we have an idea of why that activates the child, because a dog barks and their brain stores that, and they say, oh my gosh, I've been bit or mauled by a dog, so that's my activator, and I have PTSD from that dog that bit me when I was 5, and now I'm 10. So that's an activator, right? That's a trigger, and we can figure that out. We know that, but it's really not. It's the emotion behind it of fear. So other things that may be fearful can trigger the brain, just like that dog bite. So then the body trembles, the heart races, and you have a physiological response, because that's the vagus nerve. And there's lots more to that. Okay. So breathe a little, because I go really fast. And when I don't have any, like when we're not interacting, when I'm teaching, it's kind of like, okay. So these are just a list of things to watch for. Okay. Now the key here is excessive and impairment and chronic. So maybe I should write those 3, and I make notes as I go along, so I can add, if I need to add a couple things to this, so you remember. So the chronic is, how do we define chronic? But so here's the normal worry, right? And then here's these other things that we need to watch for that have to be chronic, impaired, continuous, when someone's daily having severe worry that turns into this list, we need to be treated one way or the other. So excessive crying, excessive. So these are excessive and chronic and daily. And so there's going to be some of these, and you're going to look at this list and you're going, oh my hell, my kids, all of them have this. Like they have everything. I'm thinking, let's see, they can't, they can't concentrate. They avoid activities. Oh wait, they're having head. Oh wait, and they're worrying, and they're not wanting to sleep, and they're not wanting to do their school, and they're crying all the time. So just make sure you look at this list and go, okay, these are just things that we watch for that are new behaviors too. If they're something that's been going on, and then we have a pandemic and chronic grief, loss, and trauma and powerless feelings, then this is going to activate this even more. So excessive worry, unhealthy eating habits, and as I've said before, in these, the 3 rooms that you're going to watch for, and out of this list, 3 rooms that are the power rooms that are very, very most important. Number 1, bedroom. So we will sleep or we won't sleep enough. Or we'll just stay in that bed, and the bedroom, and the bed problems become chronic, fight, conflict. And so the kid just, as sleeping habits are really, and we call that insomnia. No, it's like, well, it could be a lot of this stuff. And then the bathroom. So we do things in the bathroom we're not supposed to do, or we're supposed to do, or we hygiene or we don't, or we revert back potty training or not. So we go back into not potty training at 3, 4, 5. So that's a power room. And then you think about your teens. Think about it. Bathroom. Go back to so this is where we lock the door and do things in the bathroom that we are not supposed to do. And I will give you an example. No, I'm just not going to beat around the bush. Where 90% of where teens will cut, if they are cut, they start cutting and they start doing self-harm. Where is that at? That will be in the bathroom. And that's a power struggle. It's a power room. And the other one is kitchen. So what do? We avoid eating, or we will, eat too much, and we'll take food in other rooms, and that's now we're confusing the brain with what we're supposed to do. Taking food into the bed is one of the worst things we can do. And so we're confusing the brain with those power rooms. So those rooms are really important. We have to have safety in our room and in our bed, and sleep good in order to repair the brain. And avoid all of this other stuff. So just watch those rooms more than this list. Body aches, pains, alcohol use, of course, and excessive worry or sadness. The excessive worry can move into depression and irritability. So we just have to watch those. And then I have this little picture over here about the immune system. I'm super connected to teaching about the immune system because it's so related to our mental health. And if everyone's right now, we're trying to keep our immune system good, right? And we're doing everything opposite of how we keep our immune system high. Actually, we're doing everything opposite right now to do that. Not moving as much, not getting out, we got to get outside, we got to play. We have to have vitamin D3, we have to socialize, we have to touch germs, we have to get in the dirt. That helps our immune system. But when our nervous system is crashing, our immune system will go down every single day. And as it's science to me. So the adrenal gland is all connected to that. So look that up if you want. So this is just, so in the back of this PowerPoint, I found a TED Talk about, and he calls it how to take care of our emotional health, our emotional first aid. And he talks about bleeding. And it's like, how do we stop the bleeding? And I just really liked it. It's like, gosh, do we put a Band-Aid on it? So you can watch that little TED Talk that's in the back. But here's some coping. Now the rest of this is going to be coping and tips of how to cope with this. So this is just a tiny, tiny little bit of an example of where it starts. So say you have failure thoughts or loneliness thoughts. Those two really kill the immune system also, by the way. So when we have failure thoughts, we're not good enough. We did this, we can't do that right. And then we underfunction because we just shut down. And then our fight or flight kicks in. And then we have low self-esteem. Oh, and then I have another setback. And that's just a tiny little example of how this all keeps going. And I like these little bandages here. So think about, like I'm such a visual, I would have went and got my bandages and held them up to you, but I just made a picture. Because I have I bought a big pack of bandages because sometimes, it's like, oh, I'm totally out of bandages. And you just never know, it's like, it's nice to have a bandage, around. And exactly in this TED Talk guy, he talks about this is, at 5 years old, a kid knows that they should put a bandage on their cut or it makes them feel better, right? So it's like, oh, I got a cut. I cried for a minute. Oh, here's a solution. Go get a Band-Aid. What color Band-Aid do you want? Do you want, Mickey Mouse Band-Aid? Do you want a great big one because it's a nice big cut? There's lots of different sizes and abilities for Band-Aids to stop the bleeding. But we got to stop the bleeding. And our bodies can heal. Our bodies are very, very, very capable of healing. And our immune system, and we put a bandage on there so it doesn't get infected, and we have coping. So bandages are good. We always like, oh, we slap a Band-Aid on it, and that's all it's doing. It's masking it. But sometimes we just need a Band-Aid. And there is short, little, tiny things that we have to do daily that are going to help. And then you won't need a Band-Aid because, yes, under that Band-Aid, that sore is going to be gone in a couple, 2 or 3 days, right? Now, does that mean that you're not going to have a scrape again? Does that mean you're never going to have a panic again? Does that mean you're never going to cry again? Does that mean that you're not going to scrape? Or we get so fearful that we don't go outside and play again and fall off the swing, and scrape our knee. Or we teach our kids to get up and do it again. Here's a Band-Aid. There's nothing wrong with that because that's a solution-focused situation, right? But then it's like, oh, and when you have a bath, you got to take off that Band-Aid. You got to look at it, make sure it's okay. And then guess what? We got to put another one back on. So we just have to do that day to day. And if it's a Band-Aid that just helps that child feel like they have power, then they get to choose what kind. They get to choose a Mickey Mouse, a big fat one. Who cares? I'm like, get the biggest bandage out of there, my little grandkid. He's like, my 2-year-old, I'll do a story because I'm always a story. So here's a 2-year-old situation. She's 2.5. She's my grandkiddo. She's my little woman and my little man. That's what I call him. So she's had a sliver because she's out. Oh, we are playing outside all the time. And she had a sliver in her hand. So her mom held her hand tight, and then I held her other part tight so she could needle it out a little bit, and we had the bandages ready. We had them, it's like, okay, we're going to be able to put a bandage on this afterwards, and you're going to be super brave because we're going to dig this sliver out. And she, she didn't like it for a minute, but it was really fast. We just had to do it, and it was uncomfortable. But then we already had, and then we still, it was all emotional coaching. It's like, oh, it's going to hurt. You're right. And you're going to be sad for a minute, and that's okay. And then here's the bandage. Which kind do you want? And in the long run, does that kiddo know that in 2 days, that sliver is going to be so much worse? She does not know that. So we had to just try to explain to her that this had to come out now, because in 2 days, it's going to be way worse. So if you want to use that analogy to help kids, like, we got to do this now, so tomorrow or the next day, it's going to be better. That's sleep. We got to sleep better. So tomorrow so we're not under functioning tomorrow. So that's just a little bit of that, how to stop the bleeding. So here's the mindfulness. So these are coping from here on out. So this is just a little, visual that I like, because we have to know what's going on. That's all that I want that to say is what's going on. It doesn't say why, it says what. So you ask your kid, hey, what's going on? Or I see this. It's not why. We do not know why. Fill up the room. Remember, fill up the room with whys. I got my list. You've got yours of traumas, of scare, of powerless, of loss and grief, And then we label it. This is what we're feeling. This is the sound, thoughts, and emotions. Then we can react. So it's like, oh, wait, here's an awareness. And then we can non-react. And here's the non-reactive way, which is the next one is calm the autoimmune system. So that's that. So this is the list that I have for this PowerPoint. Is what the thing is so far, let's recap a little bit. When we are having worry, anxiety, panic, agoraphobia, OCD, PTSD, ADHD, autism, I could go on and on, any panic disorder, there's 14 of them about in the DSM that sit in the back of the brain. So you're sitting in your fight, flight, or freeze. And so when you're sitting back there, it doesn't matter what it is. All those things I just listed, it doesn't matter. Clinicians treat it the same way, because all that says is you're not doing self-talk and you're not up here. So when you're back here, you are an automatic response system brain. You're an automatic fight, flight, or freeze. You're not going to make great decisions. You're not going to be able to self-talk. You're not going to be able to cope. So what we have to do is scientific. This is scientific. We have to bring ourselves back here to self-talk. So we have to focus on what's right in front of you. This is all I've tried to teach people for the last 2 months, especially, is what's right in front of you. Because I've had to do it stronger than I've ever had to do it in my life. What's right in front of you? How do we focus on that? It is super difficult when we are in Wawa land, when we are in the future, when we're in the past, when we don't know when we have an unseen trauma. So we have to go to our physical sensations. We have to have full awareness, let our thoughts of the past without judgment go. So that's mindful. That's mindfulness. That's the frontal lobes. And wise mind is a dialectical behavioral term that we get in the first, in the front of the lobe. So scientifically, you only need 2 to 10 minutes to distract yourself and take a break from something of thoughts and something else, to get your mind off the urge to use, I call it, to use something. The mind to urge to go call someone, to go wash your hands again, to go, if you're compulsive, to do all those things. So it only takes actually 2 minutes to 10 minutes at the most to break that urge. So that's a lot of work though, and you have to be very mindful and self-talk and be in the present to do that. So you pause throughout the day and practice this when you're not in that state. So mindful walking, eating, imagery, body scan. This at the bottom of this PowerPoint, it says freemindfulness.org. It is free downloads of MP3 kind of guides that you can download and help have someone walk you through that. Mindful eating is one of my favorite things. Mindful walking. You can just look those up. There's lots of different mindful practices. So mindful eating, I like eat really fast, and like I have to like slow down and eat and be present and do one thing at a time. So how to calm the automatic sympathetic nervous system is these things. These are super important and they work, and I'm going to go through each one of them really fast. So you know what they are. 4 square breathing. It's just 4 square breathing. You breathe up 4 counts, and I have the kids tap like this, or you or anyone, under their desk, or in their pocket. So tap 1, 2, 3, 4 up. So you breathe up 4, hold it for 4, and then breathe out 4, and then wait 4, and then do it again 4 times. So you breathe up 4, hold it for 4, breathe down 4, wait 4, and then do it 4 times. You're going to bring your heart rate down faster and easy, you know, and that's way less than 2 minutes. You do that 4 times, and that's going to be 30, 60, 90, you know, seconds. So it's something that you can take power over. And when we're tapping and we're being present, we're going to breathe. And then we can make a decision, or then we can call someone, and then we can do something else. But that has to start with some, you know, that's a good idea to start with that one. And then trace, color, record. So drawing, writing, there is so many statistics. If kids mind dumped or wrote about their feelings 15 seconds before their test, it was about 15%. Those kids that did that, they did way better. So it was about 15% that didn't. It's a very high percentage of those that got to dump their feelings or their stressors before their test, or before they did something difficult. Okay, so the other one is point focus. So this one's, I called it that because it's just it's focus point, or point focus. So I renamed it that because it's just easy. So it reminds you what to do. And if I say, hey, have you done some focus point, or did you practice that? And they're like, yeah, you know, or not. So if you have a pen, and you can use a pen, you can use anything that's just to focus on. So point focus is you hold the pen 6 inches away from your face, from your eyes, and you focus right here for 3 seconds, and then you look at the wall for 3 seconds, and then you bring yourself back to the point for 3 seconds, and you go there for 3 seconds, and you do that for, I always say, at least 6 minutes, and set the timer. And this actually scientifically will calm your nervous system. Mm-hmm. So you do that, you teach your kids to do that. If you're with your child and they're having severe worry or panic, 2 different things, you can try to do some of these things. After the fact, let them sit in it and panic and cry and throw, you know, you're not going to be doing this if a kid is crying or throwing a fit on the floor. But hey, let's breathe a little. Let's do this a little. Let's focus point for a minute. And these are important, like I said, to do outside of when you're not, just pause throughout the day and do this through the day. When people are at a 7, 8, or 9, or 10 out of 10 is strong, 10 is a panic attack, 10 is throwing up, 10 is punching the wall, whatever a 10 is like for your kids or you, or, you know, it's during the day when you're not a 10, when you're at a 5, 6, or 7, it's like, oh, I feel myself going there. So let's breathe for a minute. Let's do, oh, where's your pen? Let's focus point. And focus point. So that's why I called it that. But it is a technique. It's called something else, but it doesn't matter. But so you call someone, you make a phone call, you know, if you're a teenager, you know, they need those kind of things. They can use the Safe app, and they can text somebody. A room scan is where you stop and use your 5 senses and scan the room. What do you see, smell, hear, taste? And you name it out loud. And that's how you can coach your child if they're having full panic, to bring them back down a little bit after they're in, you know, they're totally gone. Then what do you see? What do you hear? I can feel your hand. I can see you're crying. Okay, and then you model that, and then they do it back to you. What do you see? What do you hear? So anything that you can bring into the room and get present with, because this is all about being present. And that's why I have kids carry rocks in their pockets, so they can be present and they remember where they are, what they're doing, and they hold it right in their pocket, take it to school with them. And they can always find a rock. So I always give them a rock. I'm like, find another rock. That's why there's rocks on this slide. And a worry bag is whatever they want to put in the worry bag with your 5 senses. So Play-Doh, and I'm worrying about this, and a piece of paper, and something to color and trace, and a pen to point focus, and whatever. And that bag can go with them in the car, to grandma's, anywhere. So this is emotional coaching. I'm just going to leave it like that. I just added it in. It's just another way to emotionally coach that emotion that the child is having, because it is about the emotion. It is not about anything else. And then medications. So this is deep. So SSRIs and how they work. This is just some information that if you get to that point where you need, you're doing treatment and you want to try an SSRI, this is just some information about SSRIs, and how they work a little bit. And you can talk to your therapist about that, and how there is a stigma behind there. There's lots, this is scientific. So there's times where you totally need medication. I am homeopathic in one way and clinical in another. I'm very both-sided, very, very, almost equally. So it's like, here's all the stuff that we can do homeopathic wise that helps so much, and all the stuff that I just gave you and tips. And then there's this that is just part of treatment. It can and will help this if it gets to a disorder point. It's extremely helpful to have this information, and if that's what we need, then that's what we try. And that's it. So let's get to questions real fast.
Okay, so we haven't had any questions come in, so everyone send them in if you have some. I have a question though.
Okay.
A personal one. So as you know, I have a 2-year-old, and every time one of the big earthquake, well, the big one hit, and then all the bigger tremors hit, I don't know how, but sometimes, every time, it was when she got into bed.
Right.
So it was either while she was sleeping, or her nap time, or she had just got in for her nap time. And so now not every time, but a lot of the time, when she gets into bed, she's super scared that it's going to happen again.
Right. Because worst case scenario, it was associated with one of the power rooms, which is bedroom. And, it's like, oh, we're all home and they weren't in school or all that stuff. Great. But we were in bed when it happened the first time. And then one of the big aftershocks we were in bed again. And it's like, oh no, we've got 2 associated with sleep now. So this is acceptable, right? We kind of know that this is probably the result of that. So how do we reassure? It's going to just take a while, because it really does, but we don't want to get into that chronic 6 months of this. So we just know that the first month is going to be an acute stress, and they're going to have stress around bedtime. And so it's like, so what do you have power over with you? Okay, this is scary. Laying in bed worrying is not what we do when we're asleep. When we're associating sleep with worry, then we've got a problem. So we train our brain to worry when we go to bed, right? And so emotionally coaching her, so it's like, okay, here's your emotion. What is, at that age, they can have power over how they solve this. It's, it's same thing with, like, if a monster was in their room, right? I mean, you face it, you get a plastic bat, and they beat the bed, with the bat before they go to bed. And they know that they have just really beat that monster. It might come back, but you know what? I'm going to get up and I'm going to have power over this. So it's anything that you can, talking to her about it, of course, but at that age, it's so difficult because they don't realize what's happened to their brain. They've associated sleep with this weird feeling of an unknown, unseen trauma.
Right.
And our physical body just like held this weird feeling from that earthquake. And so we just have to talk about it and do everything outside of the bed until then you put them in bed, and then that's when you train your brain that that's just for sleep. So, yeah.
Sounds good. Thanks. Okay, so we have a couple questions that came in. So someone said, can you talk more about feeling dumping? Is there a specific time to have that? And what does that look like / procedure for calming a child or a teen?
Okay, so like dumping, is that what you said?
Yeah.
Mind
So
dumping?
can you talk more about feeling dumping? Is there a specific
Yeah.
time to have that?
So no, it's all the time, every time. Every time we have a feeling. I mean, if there's times where the child can go self-regulate themselves, I think this would be a great time to do this or this. Do you want to do that in your room with your whiteboard and your feeling bag and your bat, and your stuffed animals thrown in the corner, like something to aggression to get out? Or do you want to do it in the laundry room, or do you want to go out in the backyard and take your, take this with you and color about it or draw about it or write about it? That's mind dumping, but usually, or emotion dumping. But what we want to do is do that every day, like in the evening, especially. So we dump it and we record it and then we keep track of it, and that helps relieve it and unstuff it. So anytime you can unstuff and celebrate, that's a celebration. I call it Slurpee Day. When we unstuff an emotion and we let it out, that is Slurpee Day. We get to go to 7-Eleven and get the worst thing that we can put in our body, and it's all mixed with different colors, and we get to slurp it down. That's funny, huh? But that's what we do. We have to celebrate that we got something out because we don't want to stuff.
Okay, the next one is, I have a 10, almost 11-year-old who it seems like acts like everything is happy at the beginning, but seems like lately she is more moody. Are we moving into another stage?
Yes. So it's called, the first stage of burnout is called honeymoon burnout. We had a blast the first month. We got to sleep in. We're in our pajamas, in our, stretchy pants. I've been in my stretchy, I've been in jeans. I'm like, what? It's honeymoon burnout. We didn't get to go to school. Oh, this is fun. Oh, we could eat cereal, at lunchtime. Yeah, we don't have a routine. Okay, and we're just surviving. So then we move into, that was the acute stress, and it's associated with honeymoon burnout. So now we've gone into other kinds of burnout. And then if we go into chronic burnout, which is that last one, right? That's like 6 months of going into that chronically. But yeah, we just move into another one, and it's like, wait a minute, this is lasting too long. So do you see what kids do? Wait, we're supposed to be back to school. Wait, where's my friends? Where's my soccer team? Where's my scouts? Where's everything? Everything. And so as we go longer into this, and we've tried to come up with new routines, new creative activities, new social, techniques. We're doing piano lessons, virtual, stuff, right? So we're still trying to do it, but it's not the same on the brain. So the child goes into grieving. So our children are grieving, and we've got to let them grieve. And this is very, very difficult. And this is not going to get better before it gets, it's going to get a little bit worse. And as it goes on longer, and then we're going to have to come out of this and really make sure that we label and listen and validate and all these steps of emotional coaching. It's going to be rough. Because think about it, the swimming pool's not open. What's Memorial Day? What do you do? The first thing the Memorial Day does. This is a routine that we've done for 100 years, since World War I, since the Depression. We've never had things like this happen. So think about it. No swimming pool. We don't go swimming. So guess what we're going to do? Well, I just bought a pool and put it in my backyard. So.
Awesome. Okay, we have a bunch of other questions, but before I get to them, I know we're after 1, so I just want to thank everyone for being here. And like Carol mentioned, we have tons of workshops. We have a financial one tomorrow that we're actually having somebody external do that one, so it'll be kind of cool to see what they've got to present. And then like Carol has said, we have these parenting ones every month, so watch for the one for next month. So thank you, everybody. Okay, I'm gonna.
Thanks. Yeah. If you need to go, but And you'll
Yep.
get this later, but we can stay on for a minute.
Yep. Okay, let me read some of these other ones. Can you have more than one disorder?
Absolutely. There is very rare that there's only one. It's very what's the word? It just slipped me, So yeah, so there's very high percentages in the DSM of like, this goes with this. ADHD goes with one of the anxiety disorders, or depression and ADHD go together a lot, so yes, what's the word? Something. It's right there. But yeah, no, it's very, very common. So there's usually a primary and a secondary. What was it?
Correlation.
Yeah, there's correlation. That's not that. Yeah, there's some correlations, but it's not. It's like that. But it's it's like some of them are like 75% are correlated with each other, but it's it's a something. Anyways.
Okay, so this one's kind of worded odd, so I'm trying to figure it out. But so more fears are showing up, and how do we get our children to recognize the what?
So that's where we go emotionally coaching. So what's going on? So, and you go into the emotion first, always. It's about the emotion, because emotion is what we can't skip over, because then they'll have a behavior, right? So what's going on is you can feel what's going on. You're a parent, you have these abilities, right? So we know we've had them before. So these kids might not have had these before. That's the problem right now. So we have to recognize the opportunity to teach. Then we have to be aware of our own intelligent emotions. So we have to start with emotional intelligence of 10 emotions a day. What are you feeling? What's going on? And then get a chart. And I have many charts, little faces. I have cards that I go through all these cards with, and in play therapy, I just go through these cards and I'm like, so when's the last time you were this? And when's the last time you were lonely? And when's the last time you were hopeful? And when's the last time you were overwhelmed? And so that starts their intelligence of emotions, and they will know what's happening. And at the same time, we don't know what's happening, right? What's going on? Well, I just am sad. I'm just lonely right now. I'm just really angry. Okay. But, even if you can find one of those, like I'm really irritable, and it's not why. That's the mistake. We don't correct and we don't ask why I'm feeling this way.
Okay.
Yeah.
This one is, my teen children of a recently blended family are all happy and laughing, and then with no warning are instantly withdrawn and almost in tears. I understand that I don't know what the trigger was, but how do I help them at that exact moment in front of everyone without embarrassing them?
Okay. So that goes into, we are going to be an emotionally intelligent family, and it seems like you're upset. Would you like me to, do you want to go out here and talk to me about it? Do you want to leave the and we don't, it's not about isolating. We don't like the child to leave the classroom, but teachers are really good at this if they're really, intelligent in emotional coaching is, hey, I see, it seems like something's wrong. Let's remove you and put you over here. So they aren't embarrassed. Or have a signal, a sign to talk about that ahead of time. So really you have to set limits and problem solve ahead of time as a family, and say, and there might be one kiddo that is a little bit more sensitive in that area. And so instead of shaming and not allowing shame of, you're a flawed person because you have emotion, you just broke down, what's wrong with you? Why are you doing that? And everyone else is fine. So things like that, if that makes any sense. And yeah, I don't want, so say it. I feel like I don't want to embarrass you. So what would you like to do? And that's problem solve from the kid. The kid will come up with the problem solving, solution. But there has to be limits. So number 5 on this emotional coaching is setting limits. You know what? If you want to throw a fit, you can throw a fit, but you can do it here and here, and you're not going to do it at the dinner table. So And if the child feels embarrassed because of what you did, then the next time what would you like me to do next time then?
Okay. And then this one is preteen is wanting to spend all of his time in his bedroom. He's a single child, completely new behavior, sounding whiny constantly. I can't figure it out. Even wants to eat in his room. When he's not in his room, he's acting anxious. Your thoughts? He is doing school in there as well. It's puzzling.
So go back to the room. The bedroom is one of the biggest rooms, right? And it's number one. So that is where we only sleep. We do not do homework in our room. We do not eat in our room. So we got to set limits right now. He's a preteen. Get some limits on that. And he has to come up with it. Reward system and then consequences. So here's your reward system first. Oh, you know what? But we are not doing homework in our room ever again. That is the biggest one that you have to eliminate. So he's got all the power? No, he doesn't have any power. You have no power. You're letting that go on, right? Because he's wants to self-isolate. Look at that list. He's going to have most of those things on that list of what you want to watch for. And then there's depression that sets in because we're self-isolating. We're not getting outside. We're being in our room all the time. And there's other things going on. So, but we cannot do homework in our room. It really confuses the brain. It messes everything up. And that's what everyone's doing right now. Because it's like, oh, now we're doing it on a computer and in our room and in, so set up the rooms to only be for what they're supposed to be. And you got to set some limits, but he can problem solve. He can come up with that and then have a consequence if he doesn't follow the rules of the house, like taking food into your room. Believe me, I never thought my kid would ever be taking food into a room because that was just my number, And yeah, my last teenager out of all my foster kids and my kids, she eats in her room. She takes a bag of, treats in there and watch it, but so I get it. But she's also 17 and a half. But at 14, at 13, at 12, at 10, nope.
Okay. So someone asked, they wanted to set up an appointment to talk to you, Carol, or any of the therapists. So the best way to do that is to call our office. That phone number is 801-262-9619. And the support staff team members can help you get scheduled. If you want to see Carol specifically, she's a popular lady, so it might be a little further out from when you'll get to see her, but you can request to see her specifically, or you can ask the support staff to make a recommendation for you, and they'll get you scheduled. So it's really straightforward.
And we have a cancellation list, and if someone cancels late or you can get in the next day or something, then put yourself on the cancellation list. It happens all the time. We're pretty good now because we're doing virtual, so people are, but yeah. And I do private practice if you really, cannot. If you have a serious crisis, then let us know. Email me too. And I don't want you waiting 5 weeks if there's something going on and you've got it. There's other people to get in with Blomquist.
Yep. Okay. The next one is, what are some physical symptoms of the body associated with anxiety and stress?
Oh, okay. So the adrenal gland starts. So it sends messages to our brain and our heart and our, and everything. So it goes to our brain. So these are the symptoms of a true panic, right? Tunnel vision, not knowing really where you are. You can have speech impairments. You won't even be able to put out a sentence. That's serious. You can vomit. You can have high blood pressure. You can't breathe. You're shallow breathing, shaking, sweating. It feels like, and I've got one section on what that looks like physically, cognitively, emotionally, and mentally. So I can add that to this PowerPoint and send it to you. I haven't sent you the final PowerPoint, Heather, so I'll add that into this one, and it describes all the list of what everything's going on in your body cognitively. You might not be able to remember something. You'll totally zone out. That's from panic. That's your body shutting down. Remember, you don't have any control over it, and you go into numb. You go into what was the other word that was like right here? So trapped. So when your vagus nerve is in operation, you shut down, you're out of focus, you can't, yeah, you feel trapped, you can't escape from that. And that's when the body says, you're going to die right now. Maybe you might die, and your response system kicks into gear. Your heart pounds, your body trembles. Yeah. Not fun.
All right.
I have kids leave the classroom and have to throw up. And to me, that's a 10. And if you have to throw up, if you have to leave the classroom, that's a 10. And a throw up is 11 out of 10.
Okay, I think this one's from a teacher. So they said, teens who have not responded to teachers and they have not completed any of the assignments since school went on online education. Parents have been informed. Parents don't know how to encourage their kids to do their work. Are teens possibly being depressed and suffered from anxiety?
Absolutely. But it's also just once again, we're just out of focus. We're shut down. And this is my report from the last month from teachers and kids, is about 75% are done. They are over it. They're done. 75% are not doing their homework. I have a friend that's an art teacher, and she's like, yeah, art's not really important right now for everybody. So over 80% of her kids are just not turning in anything. And yes, they are informed. We're trying our best. The teachers and the parents are going, and I'm so glad you brought this up, because this is the other part of this. In that little list, it says, oh, avoiding school. Yeah, because we're over it, because it's just virtual. We don't have to, we're not on routine. We're not going to school. We're not sitting in front of the teacher. It is, the next 2 weeks are going to be over it. I predict it. It's just, they're going to be over it. And it's, yes. And then we social isolate, and we're just sitting, yeah. And we're just shutting down, and we go into a numb state. And it's like, and then this parent is fighting their teen to do their homework outside of their bedroom. Good luck. It's tough as the weather gets warm, and yeah.
Okay. So this one is, my 6-year-old lies so much. He will lie to me as I'm standing there watching him do what he is lying about. I tell him I am far more sad about the lie than the actual reason he is getting in trouble. Am I handling this okay? I don't know what to do about the lying.
Okay, so that is, it's emotion first before the behavior. So there's something going on with the emotion, and it's usually a power. I'm powerless, so I'm just going to lie. So I don't have the consequences. So that one is Love and Logics, the whole PowerPoint, the whole class that I did on that. And I have the whole workshop, so just email me and I'll forward that to you, or Heather. And that is that. Choices. It has a whole pearl on lying. It has, because we got to get into the emotion behind that. It's an emotion. It has nothing to do with the behavior. So we focus on the emotion. And of course, there's a consequence to the behavior, but let's just scale back on the behavior. And, and what's the reward? Because we focus on the behavior, and it will continue. So we got to go back to the emotion and choices, and him finding his own power in that. And that's Love and Logics theory stuff.
Okay, and then this is the last question. So it says, I am a teacher, my husband is a professor, and my son is in school. We live in a very small home doing 3 classes all at one time, different classes. It's hard. Separating has been the only way to get work done. Not being in a bedroom is next to impossible. Help.
Right. Okay. So this is, yeah, that's understandable. That makes sense. And that's a good question, because space, and I've been thinking a lot about space and teaching about that, is what is your space? We've blended our space, right? So bedroom is only for sleep. Oh, now wait, no, it's for homework, or wait, now it's for doing a Zoom class, or, and working in our bedrooms. It's like, what's happened? So this really confuses the brain. So just do the best you can. This hopefully is not forever, But the best advice that I was given and that I've had to do and that I've been telling and helping suggesting for people to do is get up and leave that space as often as possible and go outside. So you have to come back and forth. So just do the best you can. The only reason why we don't want to do work and Zoom and electronics and eating in the bedroom is because we're supposed to only sleep in there. So what happens is our brain gets confused and then we'll have sleep issues. And we just want to avoid that. If you're sleeping okay and you can really shut it off, leave the bedroom, go outside, come back, and then sleep is just for sleep. Bedroom is just for sleep. And you turn that in, like you trick your brain into thinking, this is my work and this is my school, and then this is my bedroom. This is my sleep. And I've had to do that just in my own house. This is my work, but it's not. It's in my house. It's like weird. And so it's like, so I have to say, oh wait, here's my space. This is my pretend space. And then here's the rest of my world. And it's like downstairs. It's really weird. It's like, wait, wait. I can go outside and set, then come back in, So just open up your space as much as possible. And if you're not having impairment or issues with doing homework in the bedroom and you're all getting it done and you're okay, that's okay. It's not a big deal, because this will end. We will hopefully, have better space again and go back to, I like my driving space in the car, driving to work and back. So I've even had people do that routine as much as possible. So we keep our brain going with what we're supposed to be doing in those rooms. But yeah, does that make sense? Hopefully.
Okay. So we're 20 minutes after we were supposed to end. So I'm going to take one more question that was typed in, and then that's it. So if you have any more questions, you can email me or Carol, and we'll get them answered. So Carol's email is caryl@blomquistel.com. Okay, so this last question. I have an almost 5-year-old who has been refusing to be out of our sight for a couple months now. He said he's worried about somebody taking him and that he's had a bad dream about someone taking him. We can't assure him that he is safe.
So this is happening a lot. These are such good questions, because I'm seeing this repetitive all of a sudden. So the separation part, right? So they will not go into the bathroom themselves, and it's between 5 and 8. It's a very young age where they're just not separating themselves. And I don't know if it was the earthquake, if it's just this attachment all of a sudden issue of an insecure attachment. That's what that is. So it's like, so you coach that, you draw about it. He's got to unstuff it. So if he had a nightmare, we're going to draw about it. We're going to get creative. We're going to imagine that, what would happen if you did get taken? So go for it. We're going to have a plan now. This is what would happen. And so this will only get worse. It goes into obsessive thinking, right? And then compulsing. So it's like, I'm worrying. And then I'm going to compulse on, I don't want you out of my sight. I have to sleep with you. I have to go to the bathroom with the door open. I have to, and I'm afraid that I'm going to get taken. It's not about being taken. It's the emotion behind it of feeling hopeless or powerless. So how do we give back power to him? But we got to untrap those feelings first, so it doesn't hold in for 6 months. So if he did have it, so if he's sharing that, then we're going to get, and you can do a couple play therapy sessions around that and get it out. So you draw, you color, you talk about it, you got to get it out, and you got to go through all those feelings, right? So constantly talking about it. And then he's like, so when you have those feelings of you being taken, what do you want to do about it? He will come up with some I've had kids come up with some fantastic ideas. They have an imagery in their head that they write off on a unicorn. And then you're following them, and they're always safe as long as they're on that unicorn. I mean, it's imagery. It's like imagination, and they have power over their brain when they do that.
Thank you, everybody, and hopefully we'll see you at a future workshop this month, and if not, we'll see you at the parenting one next month, hopefully. So
yeah, thanks.
Great rest of your week.
Thanks, everybody. Thanks, Heather.
Yep. Thanks.